let me use this opportunity to thank the leadership and members of this Honorable House, and indeed the entire National Assembly, for your immense support and determination to help the country fight this pandemic. Mr. Speaker, honorable members, the COVID-19 was declared a global pandemic on 30th January 2020. As at that date, there were 7,818 cases globally. Out of this number, China had 7,736, while the rest of the world had 82 cases, spreading over 18 countries. As at 4th of May 2020, the global figure had risen to 3,640,473 cases worldwide, 1,192,909 recovered, and 251,817 fatalities across 212 countries. Coming home, Nigeria's index case was recorded on 27th February 2020. As at the 4th of May 2020, Nigeria had recorded 2,802 cases, 417 recovered, and 93 fatalities. Tomorrow, 6th May 2020, will mark 100 days since the novel coronavirus COVID-19 was first detected in our country.
You don't understand.
I have given you these numbers to underscore the deadliness of the pandemic and to show the aptness of its description as the most important public health challenge of our generation. As I have often said, the virus has come to disrupt and destroy our health and our wealth. The impact of the outbreak is summed up vividly by the disruption to the global economy and to the healthcare systems that were hitherto regarded as standard and stable. More advanced and sophisticated systems have struggled in the face of the onslaught of COVID-19. Nations around the world have had to deal with this outbreak for shorter or longer days. We are, however, determined by a resolve to ensure we protect our citizens and ourselves from this virus, being fully aware of our circumstances. Mr. Speaker, honorable members, before I address the situation in Kano specifically, there is a need to lay a foundation of how far we have come in the fight to control the spread of COVID-19 since the inauguration of the Presidential Task Force. In the period under review, we have accomplished the following. Under policy focus, we have developed a multi-sectoral response action plan to guide our national response through high-level engagement with the organized private sector for better coordination of their core competencies and expertise, mobilization of states and local government area resources in preparation for the possible spread of the disease into communities, state needs assessment and state of preparedness, stimulating economic national interest to mitigate negative effects of the pandemic, encouraging our indigenous researchers to develop appropriate solutions for our environment. Arrangements are underway to evacuate Nigerians from different parts of the world. Mandatory 14-day quarantine for returnees from other parts of the world. Support for strengthening subnational level response. Engagement of local manufacturers across the board for the stimulation of local production of essential commodities to reduce dependence of imported commodities, local production of face masks, hand sanitizers, protective gear, etc. Clinical review of state of health systems in focal states and the Federal Capital Territory. Identification of available capacities for isolation and treatment of COVID-19 patients, which has yielded over 3,787 beds across facilities, and improved surveillance systems. Under the National Response Strategy, this strategy involves detection, testing, contact tracing, and treatment. And two, the efficiency of the identification, testing, evacuation, and isolation process increased significantly. Under testing and manpower expansion, we have increased the number of laboratories since we started from 5 to 21, with a final objective of establishing 1 lab per state. We have increased testing capacity with over 80% conducted in Lagos, Kano, and the FCT. The laboratories in Lagos and the FCT were expanded to have the capacity to test a minimum of 1,500 samples daily. We've increased bed space to a total of 3,787 as at 4th May 2020. We have followed up a total of 11,840 persons, representing 95% of the contacts out of 12,504 earmarked for contact tracing. About 9,828 health workers have been trained. 2,725 of them are doctors, 1,942 are nurses, and 5,161 are other health workers. That is to increase the human resource available for case management. We have also secured insurance cover for 5,000 frontline health workers through the insurance industry. Government and health professionals had to sign an MOU on hazard allowance and other incentives. Under infrastructure development, Mr. Speaker, honorable members, state public health emergency operation centers have been activated across the nation. More personal protective equipment and ventilators have also been procured. Completion of more isolation centers with a total capacity for over 3,500 nationwide. We have advised each of the state governors to provide isolation centers with at least 300 bed spaces in their various states. Under mobilization and management of resources, we have additional resources mobilized through an international community, the private sector, and public-spirited individuals. Donations have been received into a designated CBN account by the Accountant General of the Federation. Private sector donors are to deliver specific infrastructure projects to strengthen the system nationwide. And lastly, government funding has been released and utilization is at advanced stages of completion. Under relief materials and distribution, government has released 70,000 metric tons of grains for distribution as relief. It has also released through the Nigerian Customs Services 158 trucks of rice and other condiments for distribution to the states. Payment of the conditional cash transfers is being made. List of beneficiaries of the conditional cash transfer is being expanded by 1 million as directed by Mr. President. Mr. President has also authorized the employment of 774,000 Nigerians across the 774 local governments of the Federation. He has also authorized continuation of the school feeding program to sustain the nutritional value for our children. He has also commended and instructed that distribution of palliative be enhanced through an ongoing process in collaboration with the state governments. The focus is on the poor, aged, sick, and vulnerable. Under the heading of consultation with stakeholders, we have consulted significantly on all processes with the state governors. We have consulted with the leadership of the National Assembly. We have consulted with traditional and religious leaders, labor sector, security agencies, under the non-pharmaceutical measures. In order to contain the spread of the pandemic, the Presidential Task Force recommended the introduction of non-pharmaceutical interventions, which include 1, restriction of travel to and from 15 high-burden countries worldwide, closure of land, sea, and airports of entry, lockdown of Lagos, Ogun, and Kano State, as well as the Federal Capital Territory, launch the stay-at-home campaign, introduce the policy of physical distancing, observance of personal hygiene, like washing of hands. We have also introduced the wearing of masks and coverings in public places, revised NIPs and guidelines. After 28 days of the lockdown and 3 broadcasts by the President, the easing of the restrictions was introduced with effect from 4th of May 2020. And those revised guidelines include overnight curfew has been imposed nationwide, interstate travels restricted except for movement of goods, agricultural produce, and essential services. Mandatory wearing of masks and coverings introduced. Phased reopening of the economy has commenced as of yesterday. Physical distancing and personal hygiene re-emphasized. Now I come to the situation in Kano. Kano is first emerging as the epicenter of the COVID-19 pandemic in the north, which necessitated Mr. President's specific directives in his broadcast of Monday, 27th April 2020. The Presidential Task Force has been working closely with the Kano State government and key stakeholders to identify the issues and seek immediate solutions. We have deployed a technical team of 41 staff from the Nigeria Center for Disease Control, supported by 17 staff from the World Health Organization to provide technical assistance to the State Emergency Operations Center. A team of clinicians and public health experts under the auspices of the Federal Ministry of Health is also in Kano to provide training on case management and strengthen the capacity of the state to handle emergencies. A key weakness of the Kano COVID-19 response is the lack of adequate manpower for surveillance and contact tracing. The Presidential Task Force has mobilized resources from across the health sector, including multilaterals, bilaterals, and MDAs, and the private sector to push through an accelerated expansion of the rapid response teams from 21 to 50. This required the provision of 30 additional vehicles from INEC, 15 ambulances from the PTF and private sector, and a further 10 Hilux vehicles and 10 ambulances have also been pledged by the private sector. Working with partners, we are establishing at least 1 sample collection center and 2 facilitators per LGA in Kano State. In addition to a 7-day motorized campaign across major urban areas in Kano, we have mobilized about 3,300 informants through the WHO polio program for house-to-house search and reporting of suspected cases. The federal government will in due course announce significant additional material and technical resources to complement the state government's effort in combating the COVID-19 pandemic in Kano. Based on our assessment, Mr. Speaker, the following specific additional measures have been taken in Kano. Lockdown of Kano for 2 weeks. Manpower. Sent a team of experts to review the response structure and assess the situation. been working closely with the political and professional authorities. Equipment deployed equipment to the medical facilities, trained the Kano state teams of health workers. Some service ambulances from the Federal Road Safety have been deployed. The Armed Forces Hospital in Kano is also being retooled to provide additional infrastructure. Palliatives delivery with regards to Kano. We have already deployed 100 out of 200 planned trucks of assorted grains for relief for Kano State. Testing capacity. We've handed over a new diagnostic lab, 54G, supported by the Dangote Foundation. This was done on Sunday, 3rd May 2020. With that, we have increased the testing capacity by 400 tests per day in Kano. We're preparing to receive another mobile lab supported by the eHealth Africa for introduction into service, and that will ramp up the testing capacity in Kano to about 1,000 by about 2,000 by the end of the week. Treatment centers in Kano. We've inspected the treatment centers and found 2 currently functional. Muhammadu Buhari Hospital with 76 beds capacity, Kwanandawaki with 75 bed capacity. Both treatment centers still not full to capacity, due largely to resistance primarily for people not wanting to move into the facilities, and the second problem is logistics. 2 new treatment centers are being prepared by the Dangote Foundation. The urology, 3, the urology center with 75 beds, the stadium tent with 100 beds, and Sani Abacha Stadium with 200 beds. How are we strengthening the Kano state response structure? The EOC structure and processes have been improved through reorganization. We are also collaborating hand in hand with the Kano state government on the ongoing exercise. Prevention of spread to neighboring states is also a top priority. Medical personnel from states around Kano are currently being trained as part of the national response strategy. Mr. Speaker, honorable members, these activities carried out by the PTF are applicable nationwide, but more emphasis has been placed on the epicenters where community spread has commenced, with a threat to family transmission on the increase. I wish to state that the Presidential Task Force is working in collaboration with other structures set up by the President to ensure that there is a well-rounded national response. This includes the economic team headed by the Honorable Minister of Finance to examine the impact of COVID-19 on the economy, and the Economic Sustainability Committee headed by His Excellency the Vice President, the Task Force on Free Movement of Farm Produce headed by the Honorable Minister of Agriculture and Rural Development. As part of the Presidential Task Force mandate, we are working towards strengthening the country's public health emergency preparedness through system building and infrastructure development. The COVID-19 pandemic has exposed the fragile status of our health system and the near absence of structures or building blocks necessary for public health protection of our communities. In this regard, we plan to establish state-of-the-art intensive care units, stroke isolation and treatment centers in each of the 36 states of the Federation plus the Federal Capital Territory. We will also upgrade molecular laboratory facilities across the country and ensure that a COVID-19 testing center is available in every state through the utilization of existing gene expert machines. This scale-up of infrastructure will also require additional staff training and a review of existing manpower needs for the country. There is no doubt that a strengthened and well-resourced health system will not only place the country in a better position to deal with future emerging infections such as Lassa fever, but will also provide a solid foundation for medical and research and development. The post-COVID era is going to be a challenging one. As a country, we need to prepare for what will be the major changes to our long-term social interactions, events, personal contacts, and economic prospects. Just as important is the need to provide a strengthened legislative framework for dealing with future public health emergencies in a changing world. The current Quarantine Act needs to be updated to the unique nature of emerging infections such as COVID-19, the dramatic impact this has on sectors beyond just health, and the urgency required to deal with such pandemics. The President exercises powers under Section 3 and 4 of the Quarantine Act, Laws of the Federation 2004, to restrict movement of persons and goods in Lagos, Ogun, Kano, and FCT. Although this intervention generated heated debate in the legal cycles, with insinuations that it may be in direct conflict with Section 441 of the Constitution and Article 14 of the African Charter on Human and People's Rights, Ratification and Enforcement Act. The legal basis of the intervention is not debatable. However, the Act needs to be adaptable to the changing nature of human behavior and interactions. Mr. Speaker, honorable members, as I mentioned when the combined leadership of the National Assembly was briefed on the 9th of April 2020, our nation is at war against a very dangerous, unseen, and ubiquitous enemy, and all hands must be on deck to successfully prosecute the war. In addition to providing the kind of leadership already demonstrated, the National Assembly finds itself in the unique position of history to do the following, though not exhaustive. 1, develop a legislative framework to prepare Nigeria for any future pandemic. 2, develop a legislative framework for reforming and transforming our healthcare systems. 3, strengthen the legislative framework for economic growth through domestic manufacturing. And 4, deepen the legislative oversight during this pandemic and beyond. 6, pass legislations that will further ease the ability of the executive to cushion the impact of the economic decline. And 7, be part of the community mobilization and enlightenment efforts. Before I close, may I crave your indulgence, Mr. Speaker, and the honorable members, that I request the Honorable Minister of Health and the Director General of the Nigerian Center for Disease Control to brief you on the technical details of our national response. I thank you for the privilege